Hospital staff calls cops on black doctor fired after $5.9 million lawsuit. Excuse me, you need to leave this floor immediately. I'm Dr. Marcus Hayes. I work here. I'm checking on my patient in room 318. I don't care what you claim. You don't belong on this floor. Security has been notified. I'm wearing hospital credentials. My name badge is right here. I'm an attending physician. I've worked here for 8 years. Anyone can get a fake badge. You need to leave before I call the police. Call my supervisor, Dr. Patricia Morgan, Chief of Emergency Medicine. She can verify I work here. I'm not calling anyone. I'm calling the police. You're trespassing. I'm not trespassing. I'm a doctor. This is my patient. I'm documented in her chart. You can verify everything in the system. I've already called. The police are on their way. If you don't leave now, you'll be arrested. For doing my job, for checking on a patient I admitted 4 hours ago. For trespassing and refusing to leave when asked. Karen Whitfield had been a patient services coordinator at Atlanta Regional Medical Center for 11 years when she made a phone call that would end her career and cost the hospital $5.9 million. She was 43 years old, experienced enough to understand hospital protocols, but apparently convinced that her judgment about who belonged in the medical center was more reliable than credential verification systems. One Wednesday evening on the 4th-floor cardiac care unit, she saw a black man in scrubs entering a patient room and decided without checking the computer system, without asking the charge nurse, without following any proper procedure that he must be an imposter who needed to be removed by police. That man was Dr. Marcus Hayes, a 39-year-old emergency medicine physician with 12 years of medical experience who had personally admitted the patient in that room earlier that shift. What Whitfield did next, ignoring his hospital identification badge, dismissing his explanation that he worked there, and calling 911 to report a trespasser despite multiple staff members confirming he was a physician, would become evidence of how racial bias in healthcare settings destroys careers and costs institutions millions. The incident would be captured on hospital security cameras and body cameras. The lawsuit would be comprehensive. And the question that would haunt Atlanta Regional Medical Center was this: how did an employee with 4 prior incidents of racially motivated complaints against patients and staff remain employed long enough to call police on a doctor treating his own patient? A black man in dark blue scrubs with a hospital identification badge clipped to his chest pocket and a stethoscope around his neck. Dr. Marcus Hayes was walking into room 318 of the cardiac care unit at 6:42 on a Wednesday evening in March. He was carrying a tablet with his patient's electronic medical record displayed. He had admitted this patient to the hospital 4 hours earlier after treating her chest pain in the emergency department. No violation, no trespassing, no unauthorized access. Just a physician checking on his patient during his shift. But Karen Whitfield saw him through assumptions so distorted by racial bias that she could not recognize a credentialed doctor performing his medical duties in the hospital where he had worked for 8 years. Before we continue, where are you watching from? If this is your first time here, please hit that subscribe button. Stories like these need to be shared, and your support helps us bring more truth to light. Atlanta Regional Medical Center sits on Peachtree Road in the Buckhead district of Atlanta, a sprawling medical complex serving the northern metropolitan area. The main hospital building is 12 stories of modern glass and steel, completed in 2015 as part of a major expansion and renovation. The facility has 450 beds, treating over 50,000 patients annually through its emergency department, surgical suites, intensive care units, and specialized medical floors. The hospital employs over 3,000 people including physicians, nurses, technicians, administrative staff, and support personnel. The 4th floor houses the cardiac care unit, a 40-bed specialized unit for patients with heart conditions requiring intensive monitoring and treatment. The unit is configured in a rectangular layout with patient rooms lining the outer walls and a central nursing station where staff coordinate care, review medical records, and monitor patients via telemetry systems. The hallways are wide and bright, with light gray floors and white walls decorated with abstract art meant to create a calming atmosphere. Each patient room has large windows, medical equipment mounted on walls, and privacy curtains separating beds. It was 6:42 on a Wednesday evening in March. The day shift had ended at 7:00 p.m., and the transition to night shift was beginning with nurses giving report and physicians completing final rounds on their patients. The cardiac care unit was busy but not chaotic, with staff moving between rooms, checking vital signs, administering medications, and updating treatment plans. The hallways had moderate foot traffic with nurses, physicians, respiratory therapists, and patient care technicians all performing their assigned duties. The neighborhood surrounding Atlanta Regional is affluent Buckhead, one of the wealthiest areas in Atlanta. The hospital serves a predominantly white and upper-income patient population, though the emergency department treats all patients regardless of ability to pay. The medical staff is diverse, with physicians and nurses from various racial and ethnic backgrounds, but the hospital administration and patient services departments are predominantly white. Dr. Marcus Hayes had worked at Atlanta Regional Medical Center for 8 years. His shift that day had started at 2:00 p.m. in the emergency department, where he served as an attending physician supervising residents and treating patients with acute medical conditions. At 2:47 p.m., he had seen a 68-year-old woman named Patricia Reynolds who presented with chest pain and shortness of breath. After conducting a thorough examination, ordering cardiac enzyme tests and an electrocardiogram, and consulting with a cardiologist, Hayes had diagnosed Reynolds with unstable angina requiring hospital admission for monitoring and possible cardiac catheterization. Hayes had completed the admission paperwork, written admission orders in the electronic medical record, and personally accompanied Reynolds to the cardiac care unit at 3:15 p.m. to ensure proper handoff to the floor nursing staff. He had given report to the charge nurse, reviewed his orders with the cardiac care team, and returned to the emergency department to continue treating other patients. At 6:30 p.m., Hayes had checked the computer system and noticed that Reynolds' cardiac enzyme results had returned showing elevated troponin levels, indicating active cardiac damage. He had immediately called the cardiology fellow to discuss the results and had decided to go to the 4th floor to personally examine Reynolds and adjust her treatment plan based on the new laboratory findings. He had taken the elevator to the 4th floor, logged into the computer system at the nursing station to review Reynolds' complete chart, and walked to room 318 where she was being monitored. His hospital identification badge was clearly visible, displaying his photo, his name, his title as attending physician in emergency medicine, and his employee identification number. His stethoscope was around his neck. He was carrying the hospital-issued tablet showing Reynolds' medical record with his name documented as the admitting physician. He had no idea that Karen Whitfield, a patient services coordinator whose job involved discharge planning and insurance coordination rather than security or credential verification, was about to call the police and claim he was trespassing in the hospital where he had worked for 8 years. Dr. Marcus Julian Hayes had built his medical career through excellence and determination. Born in Atlanta and raised in the Vine City neighborhood, he had grown up in a working-class family. His father had worked as a mechanic. His mother had been a teacher in the Atlanta public school system. They had raised Marcus and his 2 sisters in a modest home, emphasizing education as the pathway to opportunity. Hayes had graduated as valedictorian from Booker T. Washington High School in 2003. He had been accepted to Morehouse College on a full academic scholarship, where he majored in biology with a minor in chemistry. He had excelled in his coursework, maintaining a grade point average above 3.9, while also serving as a volunteer emergency medical technician with Grady Memorial Hospital's ambulance service. The experience riding ambulances and treating patients in emergency situations had convinced him to pursue medicine as a career. He graduated from Morehouse in 2007, summa cum laude, and had been accepted to Emory University School of Medicine. Medical school was rigorous, combining intense classroom study of anatomy, physiology, pharmacology, and pathology with clinical rotations in hospitals throughout Atlanta. Hayes had distinguished himself academically and clinically, earning honors in his surgery and emergency medicine rotations. His clinical supervisors noted his strong diagnostic skills, his ability to remain calm under pressure, and his compassionate approach to patient care. He graduated from Emory School of Medicine in 2011 and matched into an emergency medicine residency program at Grady Memorial Hospital, one of the busiest and most respected emergency medicine training programs in the southeastern United States. For 3 years, he worked grueling shifts in Grady's emergency department, treating everything from minor injuries to life-threatening trauma, learning to manage multiple critically ill patients simultaneously, and developing expertise in emergency procedures and resuscitation. He completed his residency in 2014 and had been board certified in emergency medicine by the American Board of Emergency Medicine. He had been recruited to join the emergency medicine faculty at Atlanta Regional Medical Center as an attending physician. For 8 years, he had treated thousands of patients in the emergency department, supervised and taught medical residents and students, served on hospital committees addressing quality improvement and patient safety, and maintained excellent performance evaluations from his supervisors and colleagues. At 39 years old, Dr. Marcus Hayes was exactly the kind of physician hospitals valued: experienced, skilled, dedicated to patient care, and committed to teaching the next generation of doctors. He had admitting privileges throughout the hospital, meaning he was authorized to admit patients and follow their care on any unit. His credentials were verified annually through the hospital's credentialing process. His identification badge was issued by hospital security and programmed to access all clinical areas. He was a respected member of the medical staff. That Wednesday evening, Hayes had been working a standard emergency department shift when he noticed the elevated cardiac enzyme results on Patricia Reynolds, the patient he had admitted earlier. The results indicated that her condition was more serious than initially suspected and required immediate attention. Rather than simply calling the cardiac care unit and giving orders over the phone, Hayes had decided to personally examine the patient, review her condition, and coordinate directly with the cardiology team. This was excellent medical practice, the kind of thorough patient care that hospitals encourage. He had walked onto the 4th-floor cardiac care unit at 6:38 p.m. He had logged into the computer at the nursing station using his hospital credentials, reviewed Reynolds' complete medical record, including the new laboratory results, and headed to room 318. Several nurses saw him at the computer and in the hallway. None questioned his presence because he was wearing appropriate hospital identification and was clearly accessing patient records in the electronic system. But Karen Whitfield, who was working at a desk near the elevator bank, saw a black man in scrubs walking toward a patient room and made an assumption that would destroy her career and create a national controversy about racial bias in healthcare settings. Karen Elizabeth Whitfield had been employed at Atlanta Regional Medical Center for 11 years as a patient services coordinator. Her job responsibilities included working with patients and families on discharge planning, coordinating home health care services, addressing insurance and billing questions, and facilitating transitions from hospital to home or rehabilitation facilities. She did not have security responsibilities. She did not have authority to challenge credentials or determine who was permitted in clinical areas. Her role was administrative, not clinical or security related. But Whitfield had developed a pattern of behavior over her 11 years at the hospital that had generated complaints from both patients and staff. She had been reported 4 times for making racially insensitive comments or treating people of color differently than white patients and staff members. The complaints had been documented in her personnel file, but the hospital's Human Resources Department had never taken disciplinary action beyond verbal counseling and diversity training that Whitfield attended, but apparently ignored. In 2016, a black patient's family had complained that Whitfield had questioned whether they could afford home health care services, despite the fact that the patient had comprehensive insurance coverage. Whitfield had made assumptions about the family's financial status based on their race and had spoken to them in a condescending manner about payment options. The family had filed a formal complaint. The hospital had counseled Whitfield about appropriate communication and sent her to a diversity awareness workshop. No further discipline had occurred. In 2018, a black nurse had reported that Whitfield had questioned her credentials and asked if she was really a registered nurse or just a nursing assistant, despite the fact that the nurse was wearing clear identification indicating she was an RN with a bachelor's degree in nursing. Whitfield had made the comment in front of patients and other staff members, embarrassing the nurse and undermining her professional authority. The nurse filed a complaint. The hospital had given Whitfield a written warning and required additional diversity training. She remained in her position. In 2020, a Hispanic physician assistant had complained that Whitfield had asked him if he was a translator when he was rounding on patients, assuming he could not be a medical provider because of his ethnicity. The physician assistant had shown his hospital credentials and explained his role. Whitfield had responded by saying she was just checking because there were a lot of support staff on the floors. The physician assistant filed a complaint noting that Whitfield had never questioned white providers about their roles. The hospital had conducted an investigation, determined the complaint was valid, and required Whitfield to complete additional cultural competency training. No suspension or termination occurred. In 2022, a black patient advocate had reported that Whitfield had made comments suggesting that certain patients were trying to get free care or manipulate the system, with all the referenced patients being people of color. The patient advocate had documented multiple instances of Whitfield making assumptions about patients' honesty, financial status, or health care needs based on race. The hospital had met with Whitfield, discussed the concerns, and added a notation to her personnel file about the need for professional conduct. She remained employed without interruption. Every complaint revealed the same pattern. Whitfield made assumptions about people of color's roles, credentials, authority, or honesty based on racial bias rather than facts. She questioned credentials she accepted without question from white staff members. She made offensive comments that she did not make to white patients or families. The hospital had 4 documented complaints over 6 years. They had clear evidence of a pattern. They had multiple opportunities to terminate Whitfield for creating a hostile and discriminatory environment. They took no meaningful action beyond training that produced no behavior change. Do you think hospital employees should be terminated after 3 documented racial bias complaints instead of being allowed to accumulate 4 or more? Drop your answer below. Dr. Hayes entered room 318 at approximately 6:42 p.m. Patricia Reynolds was resting in bed, connected to a cardiac monitor showing her heart rhythm and vital signs. Hayes greeted her, introduced himself as the doctor who had seen her in the emergency department, and explained that he wanted to examine her because her blood test results showed concerning findings that required adjusting her treatment. Reynolds, who was white, responded positively to Hayes. She remembered him from the emergency department and appreciated that he had come to check on her personally rather than just calling the nursing staff with orders. Hayes conducted a thorough examination, listening to her heart and lungs with his stethoscope, checking for signs of fluid retention or worsening heart failure, and asking detailed questions about her symptoms. He was reviewing her cardiac monitor readings when Karen Whitfield appeared in the doorway. Whitfield had been working at her desk near the elevator when she noticed a black man in scrubs entering a patient room. She had not checked the computer system to see if he was documented as a provider for that patient. She had not asked the charge nurse who he was. She had not looked closely at his identification badge. She had simply seen a black man and assumed he did not belong there. "Excuse me, you need to leave this floor immediately." Hayes turned from the patient's bedside, surprised by the aggressive tone and command. "I'm Dr. Marcus Hayes. I work here. I'm checking on my patient in room 318. Whitfield stepped into the room, her posture confrontational. "I don't care what you claim. You don't belong on this floor. Security has been notified." Hayes gestured to his hospital identification badge, clearly visible on his scrubs. "I'm wearing hospital credentials. My name badge is right here. I'm an attending physician in emergency medicine. I admitted this patient 4 hours ago. I've worked here for 8 years. This is where bias becomes impenetrable. When someone has decided based on race that you do not belong, evidence becomes irrelevant. Credentials mean nothing. Professional attire and medical equipment mean nothing. Only the assumption remains." Whitfield barely glanced at the badge. "Anyone can get a fake badge. You need to leave before I call the police." Hayes maintained his composure, speaking in the calm, professional tone he used with agitated patients and family members in the emergency department. "Ma'am, I understand you have concerns. You can verify my credentials immediately. Call my supervisor, Dr. Patricia Morgan, Chief of Emergency Medicine. She can confirm I work here and that I have admitting privileges on this unit. I'm not calling anyone. I'm calling the police. You're trespassing." Hayes pulled his hospital-issued tablet forward, showing Patricia Reynolds' electronic medical record with his name clearly documented as the admitting physician, along with his orders for her care, his admission note, and his physician identification number. "I'm not trespassing. I'm a doctor. This is my patient. I'm documented in her chart right here. You can verify everything in the computer system in 30 seconds. I've already called. The police are on their way. If you don't leave now, you'll be arrested." Patricia Reynolds, the patient, spoke up from her bed, her voice weak but clear. "He's my doctor. He treated me downstairs in the emergency room. He's been very kind and thorough. Why are you doing this?" Whitfield ignored the patient and focused on Hayes. "For doing my job, for checking on a patient I admitted 4 hours ago, for trespassing and refusing to leave when asked." By this point, several nurses had gathered near the doorway, alerted by raised voices. Two of them recognized Dr. Hayes because they had received report from him earlier when he admitted Reynolds to the unit. A nurse named Jennifer Park stepped into the room. Karen, that's Dr. Hayes. He's an attending in the emergency department. He admitted Mrs. Reynolds this afternoon. He has admitting privileges here. He's allowed to see his patients. Whitfield turned toward Park, her voice sharp. I saw him sneaking into this room. He doesn't look like a doctor. I'm following security protocols. Park's expression showed shock and anger. Security protocols require you to verify credentials through the computer system or check with the charge nurse. You did neither. Dr. Hayes is wearing hospital identification. His name is in the patient's chart. You're making a serious mistake. Another nurse, David Chen, who had worked with Hayes for 5 years, stepped forward. Karen, I've worked with Dr. Hayes since 2018. He's an excellent physician. He's here checking on his patient, which is exactly what he should be doing. You need to cancel the police call immediately. Whitfield's face flushed red, but she refused to back down. Admitting error would mean acknowledging that she had racially profiled a physician based solely on his appearance. I'm following hospital policy about unauthorized persons in patient care areas. Dr. Hayes is not unauthorized, Park said firmly. He has full credentials and admitting privileges. You are harassing a physician who is providing patient care. This is inappropriate and potentially discriminatory. Hayes remained calm, though his jaw was tight with controlled frustration. I'm going to step out of the room and wait for this to be resolved. Mrs. Reynolds, I apologize that you're witnessing this. I will make sure your cardiac care is not interrupted. He walked out of the room and stood in the hallway, his tablet still in hand showing Reynolds' chart with his name prominently displayed as her physician. Park and Chen followed him out, both apologizing for Whitfield's behavior and offering to get the charge nurse or the nursing supervisor to resolve the situation. Before they could act, 2 Atlanta police officers stepped off the elevator onto the 4th floor. They had responded to Whitfield's 911 call reporting a trespasser refusing to leave the hospital. The officers approached Dr. Hayes, who was standing in the hallway wearing his hospital credentials with his stethoscope around his neck and a tablet displaying patient medical records in his hand. Sir, we received a report of someone trespassing. Can you provide identification? Hayes took a slow breath, recognizing the absurdity and danger of the situation he was now in. I'm Dr. Marcus Hayes. I'm an attending physician here. I work in the emergency department. I have admitting privileges throughout the hospital. I was checking on my patient when a staff member incorrectly claimed I was trespassing. He pointed to his identification badge. This is my hospital identification badge with my photo, name, and credentials. I can provide additional identification if needed. The officers looked at the badge, then at Hayes, then at the gathering crowd of nurses and other staff members who had gathered to witness the confrontation. Whitfield approached the officers. Officers, thank you for responding. This man was in a patient room claiming to be a doctor. I asked him to leave and he refused. He's been aggressive and intimidating. Multiple nurses spoke up simultaneously, contradicting Whitfield's account. That's completely false, Jennifer Park said. Dr. Hayes has been completely professional. He showed his credentials. He's documented in the patient's chart. Karen never verified anything before calling you. David Chen added, I've worked with Dr. Hayes for 5 years. He's an attending physician. He has every right to be here treating his patient. This is racial profiling. One of the officers, whose name tag read Martinez, looked at Hayes again. Do you have additional identification beyond the hospital badge? Hayes reached into his scrub pocket and pulled out his wallet, showing his medical license issued by the Georgia Composite Medical Board, his driver's license, and his American Board of Emergency Medicine certification card. Officer Martinez examined the credentials carefully, then looked at the tablet Hayes was holding showing the patient medical record with Hayes' name as the admitting physician. This appears to be legitimate. You're a doctor here? Yes, I've worked here for 8 years. I admitted the patient in room 318 4 hours ago from the emergency department. I came to examine her because her blood tests showed concerning results. I'm her physician. Martinez turned to Whitfield. Ma'am, did you verify his credentials before calling us? Whitfield hesitated. I saw him entering a patient room. I thought he was suspicious. Did you check the computer system? Did you ask the nursing staff if he was authorized to be here? I used my judgment. He didn't look like he belonged here. This is where racial bias destroys careers. That single sentence, he didn't look like he belonged here, spoken about a credentialed physician wearing hospital identification in the facility where he worked, revealed everything about why Whitfield had called the police. Not because Hayes had violated policy. not because she had verified he lacked authorization, but because he didn't look like her mental image of what a doctor should look like. Officer Martinez's expression hardened. "Sir," he said to Hayes, "you're clearly a physician working here. We apologize for the interruption. You're free to continue with your patient care." He turned to Whitfield. "Ma'am, calling 911 for someone who is clearly credentialed and authorized to be here is a misuse of emergency services. You should verify credentials through proper channels before making these calls." Martinez and his partner returned to the elevator and left the unit. Hayes stood in the hallway, surrounded by nurses offering support and apologies, his professional authority questioned, and his presence challenged based solely on his race despite clear evidence of his credentials and role. He completed his examination of Patricia Reynolds, updated her treatment plan, coordinated with the cardiology team about her care, and returned to the emergency department to finish his shift. But the damage was done. The incident had been witnessed by dozens of staff members and patients. The hospital's security cameras had recorded the confrontation, and Dr. Marcus Hayes had experienced firsthand the racial bias that his black patients had described to him for years. Within hours, multiple nurses who witnessed the incident had reported it to hospital administration. Jennifer Park had filed a formal complaint describing Whitfield's pattern of racially biased behavior, and specifically noting that Whitfield had called police on a credentialed black physician without verification. David Chen had submitted a written statement supporting Hayes and documenting Whitfield's history of questioning credentials of staff members of color. The charge nurse had documented the incident in the unit's administrative log. By the next morning, Dr. Patricia Morgan, chief of emergency medicine and Hayes' direct supervisor, had contacted the hospital's chief medical officer and chief executive officer demanding an investigation. The Georgia chapter of the National Medical Association, representing black physicians, had issued a statement condemning the incident. Local news outlets had received tips about a black doctor being confronted by police while treating his patient. The hospital placed Karen Whitfield on administrative leave pending investigation. The investigation took 2 weeks. The findings were unequivocal and damning. Whitfield had called police on a credentialed physician without following proper verification procedures. She had ignored his hospital identification, his explanation that he was a doctor treating his patient, and the patient's own confirmation of his role. She had dismissed multiple nurses who confirmed his identity and credentials. Her statement that Hayes didn't look like he belonged there, combined with her documented history of 4 prior racial bias complaints, demonstrated clear racial profiling. Whitfield was terminated 3 weeks after the incident. The termination letter was direct and comprehensive. Ms. Whitfield called police on a credentialed attending physician who was providing patient care, basing her actions on racial bias rather than hospital policy or proper verification procedures. Despite being informed by multiple staff members that Dr. Hayes was a physician with admitting privileges, she persisted in claiming he was trespassing. Her statement that he didn't look like a doctor, combined with her documented history of 4 prior complaints for racial bias, demonstrates a pattern of discriminatory conduct incompatible with employment at this institution. Her employment is terminated effective immediately. Atlanta Regional Medical Center issued a public apology to Dr. Hayes. The hospital announced mandatory training for all staff on recognizing and addressing implicit bias, implemented new protocols requiring verification of credentials through official channels before security or police are contacted, and established a rapid response system for staff members who experience discrimination. But the hospital's response did not prevent the federal lawsuit that Dr. Hayes filed. He sued Karen Whitfield individually for defamation, intentional infliction of emotional distress, and civil rights violations. He sued Atlanta Regional Medical Center for negligent retention of an employee with a documented pattern of racial bias, failure to address prior complaints adequately, and maintaining an environment that permitted racial profiling of physicians and staff of color. The hospital's legal team and insurance carrier reviewed the evidence and reached a rapid conclusion. The security camera footage showed the entire confrontation. Multiple witnesses had provided statements. Whitfield's personnel file documented 4 prior complaints. Her statement about Hayes not looking like a doctor was recorded in multiple witness accounts. The case was indefensible. The hospital settled 11 months after the incident. The settlement was $5.9 million. Dr. Hayes donated $1 million to establish a scholarship fund for minority students pursuing careers in emergency medicine, and to support organizations addressing racial bias in healthcare settings. Should hospitals face mandatory independent audits after employees with multiple bias complaints commit discriminatory acts against credentialed medical staff? Let me know your thoughts. Dr. Marcus Hayes testified before the Georgia State Senate Health and Human Services Committee 1 year after the incident. The hearing room was filled with physicians, nurses, healthcare administrators, civil rights advocates, and community members. His testimony was measured but powerful. I have been a physician for 13 years. I have treated thousands of patients in emergency departments. I have saved lives. I have taught medical students and residents. I have served on hospital committees working to improve patient safety and quality of care. I have dedicated my career to medicine. He paused, making eye contact with committee members. On that March evening, I was providing medical care to my patient. I was wearing hospital credentials clearly identifying me as Dr. Marcus Hayes, attending physician. I had a stethoscope around my neck. I was carrying a tablet displaying my patient's medical record with my name documented as her physician. Karen Whitfield saw me and decided I was a criminal trespassing in the hospital where I had worked for 8 years. Another pause. She did not check the computer system that would have immediately verified my credentials. She did not ask the charge nurse. She did not look closely at my identification badge. She called 911 and reported a trespasser. When nurses who worked with me told her I was a physician, she dismissed them. When I showed her the patient chart with my name as the admitting doctor, she claimed it could be fake. When my patient confirmed I was her doctor, she ignored her. His voice remained professional but carried clear authority. Ms. Whitfield had 4 prior documented complaints for racial bias over 6 years. 4 complaints from patients and staff members describing a pattern of discriminatory assumptions and comments toward people of color. The hospital counseled her. They sent her to training. They documented concerns in her file. They took no meaningful disciplinary action. They allowed the pattern to continue until she called police on a black physician treating his patient. The conclusion was direct and uncompromising. This is systemic failure. Hospitals cannot claim commitment to diversity and inclusion while retaining employees who repeatedly demonstrate racial bias. They cannot send people to training workshops as though education alone changes deeply held prejudiced beliefs without accountability. They cannot protect employees who create hostile environments for patients and staff of color. When a hospital employee can call police on a credentialed black physician and face no consequences until that physician pursues litigation, the system is broken. The room was completely silent when he finished. Should healthcare institutions be required to terminate employees after 2 sustained complaints for racial bias rather than allowing patterns to continue? Comment your answer below. This case was not about one employee harassing one physician. This was about an institution that allowed Karen Whitfield to accumulate 4 documented racial bias complaints over 6 years without termination. This was about a human resources system that treated diversity training as sufficient intervention despite evidence that training produced no behavior change. This was about a hospital culture that tolerated discrimination against patients and staff of color until that discrimination became so egregious and public that ignoring it became impossible. 4 complaints in 6 years. That is not random. That is not miscommunication or misunderstanding. That is a documented pattern of racial bias. A pattern that Atlanta Regional Medical Center had in writing, verified through multiple investigations, and failed to address adequately until Whitfield called police on a physician providing patient care. The confrontation between Karen Whitfield and Dr. Marcus Hayes was the predictable outcome of inadequate accountability systems. Whitfield believed she could question credentials and challenge the presence of people of color in the hospital without consequences, because the institution had taught her through years of insufficient discipline that diversity training was the only penalty for discriminatory conduct. She was wrong, but only because this time her target was a physician with the credibility, resources, and professional standing to pursue justice effectively through litigation. Dr. Hayes' lawsuit cost Atlanta Regional Medical Center $5.9 million. That is accountability. Karen Whitfield's career is over. That is consequence. The hospital implemented new policies and training. That is institutional response. But financial settlements and policy changes do not undo the humiliation of having police called on you while treating your patient. They do not restore the dignity of having your professional credentials questioned in front of colleagues and patients. They do not erase the message that even a medical degree, even hospital credentials, Even verification from colleagues and patients is insufficient protection from someone who has decided based on race that you do not belong. The real question is, what changes now? Do hospitals finally implement automatic termination after 2 sustained bias complaints, instead of allowing patterns to reach 4 or more incidents? Do human resources departments finally recognize that diversity training without enforcement is merely performative gesture that changes nothing? Do healthcare institutions finally acknowledge that protecting employees who demonstrate racial bias creates liability and damages institutional credibility? Because if we do not fix the systems that retained Whitfield for 6 years despite documented bias, if we do not address the culture that treated her complaints as minor issues requiring training rather than termination, then we are simply waiting for the next employee, the next physician or nurse or patient of color, the next 911 call proving that racial bias remains embedded in American healthcare institutions. Comment if you believe this should be law. Healthcare employees with 2 sustained complaints for racial discrimination must be terminated and prohibited from employment in patient care settings. And if you think these stories need to be told, if you believe accountability requires exposure and institutional change demands public pressure, then hit that subscribe button. We are not stopping. We are going to keep exposing these patterns. We are going to keep demanding better. We are going to keep fighting for the physicians, the nurses, the healthcare workers, the patients who deserve environments free from racial bias and discrimination. This is not just about one employee or one doctor or one hospital. This is about all of us and the healthcare system we choose to tolerate or the system we demand must change.